Let me go grab some more unsweetened tea because this the age I am right now. That now we're drinking unsweetened tea. Ugh. I can't believe it myself. So, say what you must. I get it. Woo! Shit, I still didn't set. Sometimes I'm embarrassing to myself. Still didn't set up the everything I need, but that's all right. I don't want to be in this category. That's what I should have changed it to education. Let's do that. Um, hello, hello, hello to everyone here. This is an adults only space, an adults only space. Okay. I love the kids. I do. I love the children, but this is not a space for the children right now. Okay. Although we're not talking about nothing bad today, um, we are still going to be discussing things that are going to be adult centered. Today, we are talking about menopause and the effects that it could have on your mouth. Not very many people know that. Not very many people know um, that your ovaries actually dictate a lot of the things that go on in the body. So, even things that don't have anything to do with reproducing, like your teeth. So, that's what we're going to be talking about today. So, we're going to be talking about freaking. Like, I'm mad at myself because, well, I don't know. I don't know if that's where they're coming from. So we have like there are gnats. Now I thought it was from the plants that I brought in. Um, but the plants aren't in the house anymore. So I don't know. I don't know where it's coming from. Unless they just all as soon as the plant got here, just they just started kicking it. They was like, "Oh shit, we got a good place, y'all. Let's come here." I don't know for sure, like what the reasoning is, what's going on, but um, if you see me fanning, it's not illicit substances. Okay, there's probably a net somewhere. Uh, we've got all the things to um try to address them. So we'll just see. We'll see. But yeah. So let me catch you up because this is my show. I can do whatever I want to do. Before we get started, let's talk a little bit about the week. So we have a pretty interesting week coming up. There may be some days that I'm supposed to be here that I may not be here. Just depends on what these kids want because the kids come first. Okay. So it is Boys Week. Every year for the summer, I get all of my friends' kids, which are my nephews. I get all my friends' kids and I keep them for a week. Okay. So the boys are gonna be here. My nephew texted me. His mom just texted me and was like, your nephew want to know where you at, but I had already talked to his dad. So like, but I get that. I love that. I love that they be ready. Like, we supposed to be over at Natasha's house. What's going on? So love that. And so it's gonna be Boys Week. So some days, oh, okay. Let me see. Hold on. Oh yeah. Hold on. One of the kids' parents is texting me. All right, all right. Okay, so let's talk about menopause and your mouth. Okay. Excuse me. Hold on. I want to make sure I get all the chats set up. I think I found a new way so I can see all the chats and know what's going on. Okay, that works perfectly. All right, all right. Um, where are we going? Here. Okay. So menopause in your mouth. Again, there are certain types of changes that your body is going to go through um, throughout the throughout your life. Honestly, there's going to be all kinds of things that are going to happen, and some of those things are going to happen due to changes that are supposed to happen, and some could happen just because that's just the way life rolls. Well, knowing that menopause can affect your mouth is very important because your dental health is very lucrative to the rest of your health, right? They're finding more and more things that they think are linked to. Now, I don't know if this is true or not. Okay, that's not, I don't know. I'm just going to say what I heard. Okay? I just saw that recently they were saying that there's a link to Alzheimer's and your dental health, right? So, your dental health is super, super important to other parts of your health and other parts of your body that you may not think is necessarily linked. So that's what we're going to be chopping it up about today. Okay. Um, let's see. Is this, if I do this, is it going to go that way? I never tried to do it this way. Oh, okay, that did work. Okay, so after we go through this today, you are going to be able to name at least 3 or more oral health symptoms of menopause and list at least 2 or more ways to improve oral health during menopause. Okay. So, those are the things that you should be able to do once we get finished with this course. All right. Okay. So, menopause in your mouth. Overall bone health reduces once the estrogen levels in the body decrease. This can also affect the teeth, gums, and more. Research actually reveals that more than 25% of postmenopausal women are at risk of losing teeth, and they may be at an increased risk for tooth decay and gum disease. Menopause can also affect bones, reducing the relative anchorage that the jaw has on one's teeth. Periodontal health is most severely affected by up to 60%, followed by dry mouth, 25%, and burning mouth, which is glossodinia, 15%, which we will discuss along with other common mouth symptoms. Estrogen receptors are identified in both the tongue and the vaginal mucosa. Let me say that again. Estrogen receptors are identified in both the tongue and the vaginal mucosa. So the link is there, right? Um, we're going to talk about each one of these, each the breakdown of each one of the numbers that we just spit off, because I want you to have a very good idea of what to expect with your periodontal health. Okay. All right. Fluctuating hormone levels can affect the level of Candida albicans present, potentially resulting in an overgrowth in the mouth. That overgrowth is commonly referred to as oral thrush. Oral thrush is a fungal infection caused by the overgrowth of the bacteria Candida albicans. I don't know if that's how you say that, but that's how I'm going to say it. White patches will appear inside the mouth, primarily on the tongue and cheeks. You may also experience redness in and around the mouth, loss of taste, raised sores with a cottage cheese like appearance, difficulty swallowing, cracking in the corners of your mouth. So you will experience cracking there, and burning or sore throat. Okay. So, what happened? Oh no, that don't have nothing to do with y'all. Okay. Those are some of the symptoms you can see. I'm going to say them again just because I want you to listen for some of the things that you might be experiencing. So we have redness in and around the mouth, loss of taste, raised sores with a cottage cheese appearance, difficulty swallowing, cracking in the corners of your mouth, and burning or sore throat. Okay, those can be the symptoms of oral thrush. Now, you can get oral thrush for a bunch of different reasons, but one of the reasons could be due to a decrease in the estrogen that the body has access to. Come on. Oh, and you know what else? Forgot again. Go back. Okay, burning mouth syndrome. Actually, I think we went too far. No, we didn't. Burning mouth syndrome. Now, this one, listen, not anything you would have expected to have to deal with, but burning mouth syndrome is described as a burning sensation affecting different areas of the oral cavity. So, tongue, palate, lips, and areas of denture support. So if you have partials or any other kind of dentures, you will feel a sensation in that area. Burning mouth syndrome, also known as glossidonia or stomatodonia, is characterized by the absence of pathological findings, meaning it feels kind of like what you see here in this picture, but the mouth looks completely normal. Burning mouth syndrome can involve multiple sites, but the tip of the tongue is the most common location at 71% of cases, followed by lips, 50%, lateral border of tongue, so that's going to be your side, at 46%, and the palate, okay? The accompanying symptoms may include dry mouth or alterations in taste sensation. So you may have a change in the way that you taste food. You may have a loss in the taste, or just there are different areas on the tongue that process different kinds of taste sensations. And so you could lose access to one or more of those parts in burning mouth syndrome. Symptoms may develop gradually or occur spontaneously. It could start as a tingle or come on strongly. BMS can be characterized by its cause or symptoms. Type 1, you may experience no or low intensity pain upon waking up, but the pain quickly picks up after your first meal and continues throughout the day, reaching its maximum threshold by late evening. So when you first get up, nothing's wrong. After you eat that first meal, you will feel that pain in your mouth, and then it will escalate throughout the day. That's going to be type 1. Type 2 of burning mouth syndrome is you may have constant pain that's present day and night. You may wake up at night from the pain associated with burning mouth syndrome, and some people who experience this type of BMS can become very anxious, right? Anytime you are in constant pain, that's going to send your body into a heightened sense of awareness, and it just makes the rest of the day difficult to manage, right? So anxiety is going to be increased, irritability is going to be increased, all those things because you're dealing with a pain source in your body that you cannot manage. Type 3, you may notice intermittent bouts of pain with some pain-free intervals. If you have any food sensitivities, allergies, or intolerances, take care to limit or avoid these foods during this time. Your diet may exacerbate feelings of pain and discomfort. So if you do have burning mouth syndrome, if you are feeling burning sensations in the mouth, it could be triggered by something that you ate or something that you drank. Coffee, caffeine's always going to have that kind of effect. Alcohol, things like that could tip it off. And you want to avoid them if you are having a bout of burning mouth syndrome. You want to avoid those items to try to help keep your symptoms in check. Menopausal gingivostomatitis. Did I say that right? Hold on, let's do it together. Gingivostomatitis. Okay. Gingivostomatitis is an oral health condition that causes gum inflammation. And so you can see here, that's pretty much just bleeding gums or inflamed gums. And you can see here that redness. And this is sometimes what you will notice about, I mean, this could happen at any point, but if you are premenopausal, postmenopausal, or in the thick of menopause, you might notice this more often. Gums may be deep red or noticeably pale, appear dry or shiny, and bleed easily during brushing or flossing. Lesions that resemble canker sores may also be present in the mouth. Gingivitis is another possible culprit. It also develops from poor habits around toothbrushing and flossing. I cannot stress the importance of flossing. Behind your gum line, it's a little bit of area in between your gums and your teeth. And so there's a area that things can get trapped. You can get plaque and all kinds of bacteria. Now, mind you, you already have bacteria present in your mouth. That is a part of the, what's going on and what happens is having that, it's one of the microbiomes of the body is the bacteria that appears in the mouth. And that microbiome can be the reason why your gums are experiencing what they are experiencing. But menopause can also trigger some of those same symptoms, and perimenopause, because perimenopause is just premenopause. Now, your teeth shouldn't fall out during perimenopause because you should not have that low of estrogen in your body from that time frame. But, nothing's impossible. Decreasing estrogen levels can cause the lining of the mouth to thin, making it more susceptible to injury. This may also contribute to an uptick in pain sensitivity. Okay, so the protective enamel on your teeth can also lose its integrity during menopause. If left untreated, the nerves inside of your teeth may become exposed over time, causing pain and discomfort, particularly when consuming hot, cold, or acidic foods and beverages. Okay, so you may be running into not being able to drink your coffee like you want, ice water starting to feel like what's going on, like all those types of things are a byproduct of menopause, like one of the things that can happen during that change. So of course, during that time frame, you're going to have to make sure that you are minding what you are eating and drinking and putting in your body, especially if it's going to be causing you pain. But if you do feel that pain, you need to go to a dentist to make sure that you don't have any holes in your teeth. Get those filled as soon as you can. And just make sure that you're taking care of closing up any gaps. It's just like a gap in a home. All kind of things can get in, all kind of things can escape, and that's not what we want. So if you are feeling that tooth sensitivity, it's a good idea to make an appointment with your dentist so they can take a look and make sure that you're not moving toward exposed nerves, because exposed nerves, baby, you do not want that, okay? Menopause can change the composition and amount of saliva the mouth produces. These changes can interfere with the mouth microbiome, increasing the risk of tooth decay and oral infection. A dry mouth may feel sticky or tingly as though your mouth is burning. You may also experience halitosis, commonly called bad breath, cracked lips, or mouth sores. Dry mouth can make chewing, swallowing, and even talking more difficult if left untreated. Okay, so the same way that you lose lubrication, because they said that the estrogen receptors are in your mouth and in your vaginal mucosa, when you lose the access to that lubrication down there, you also lose access to the lubrication in your mouth. So menopause can change the amount of saliva that your mouth produces, which can result in dry mouth. And dry mouth can be very painful depending on the severity, but it can also be treated. So definitely don't suffer through that. That's not necessary, okay? Oh, okay, I got kids on the way. Oh, we might do that too. Hold on. Oh, all right, all right. Compromised bone density in the mouth could lead to loose teeth, tooth decay, and ultimately tooth loss. So, people going through menopause are also at an increased risk of developing osteoporosis. Osteoporosis is a disease that develops when bone mineral density and bone mass decreases or when the structure and strength of bone changes. Osteoporosis may cause jaw recession, which could decrease the size of your gums and lead to tooth decay. Decreased saliva can also manipulate the balance of bacteria in the mouth, allowing the bad bacteria to take over and eat away at the teeth's enamel. Okay, so if you have osteoporosis and your gums start to recede, it exposes more of the tooth, which could increase the possibility of tooth decay. Coupled with that, if you are experiencing decreased saliva, you have the perfect environment for that tooth just to slide on out your mouth, okay? The perfect environment. So you have to keep that balance, that bacterial balance in check if you have things that could possibly affect it, and being able to manage that bacterial count is going to be important to maintaining your um, gum and teeth health. And also the bone health, because your teeth are attached to the bones in your skeleton. And you need for that to be healthy so that you can keep the anchorage and the teeth stays in. If that bone starts wearing away, if it becomes thin or whatever, even if you're doing all the things, that tooth just gonna hang on, fall on out. So you have to know your body, you have to know what's going on so that you can stay on top of the changes that are going to take place. Ways to improve your oral health. Okay, what can you do to keep the teeth in your mouth? That's the most important thing. What do I do to keep the teeth where they're supposed to be? You want to brush at least twice a day, especially after eating, with a soft bristle toothbrush. Okay, don't brush with one of those hard, because you can irritate the gums. You can help that receding gum line if you're brushing too hard or you're damaging the gums. So a soft bristle brush is the only type of brush you should need unless you are brushing dentures and things like that. You want to floss at least once a day. I want to remind you that there is, in between your teeth and your gums, there is a pocket of space that things can get trapped inside of. So it is important that at least once a day, preferably more times a day, but at least once a day, you are getting that gunk from those pockets around your teeth. Rinse your mouth as directed with a medicated wash targeting your needs. Okay, if you have dry mouth, they have washes for that. If you have oral thrush, they have washes for that. Hey, I see my friend. I see my friend. Hello, Mr. Yak TV. I just seen you. Welcome. You can replace your toothbrush or brush head at least once every 3 to 4 months. Okay, this is important. I do mines with the seasons. So spring, summer, winter, and fall, toothbrush gotta go. And if we keeping it a buck, I'll probably go through more toothbrushes than that because I change my toothbrush when I'm sick. I also, and this is nobody's fault or nobody's nothing, but I don't like using my toothbrush so I brush my teeth twice a day. Sometimes more if I'm going out or whatever, but at a minimum, my teeth are brushed twice a day. I don't have that big of teeth to begin with. I got to keep these little chiclets here. So I brush these little teeth twice a day. And I'm creeped out when I go back to use the toothbrush again and it's still wet. Oh gosh. Oh gosh. It's still wet. It's still wet. So sometimes I might cycle between two toothbrushes because I just don't like using it if it's still wet from the last time. That's just me. Don't internalize that for yourself. That's just me. Okay. Um, you want to make sure you're disinfecting any partials, retainers, dentures, and any other dental instruments on a routine basis. Okay, so if you got the little clear braces in your mouth, any of that stuff, any partials, any of that, you need to make sure that you are cleaning and disinfecting them. Again, you have bacteria in your mouth that's supposed to be there, but it's not supposed to be an overgrowth of that bacteria. If you do not disinfect your partials, you could be reintroducing that bacteria back into your mouth and throwing that balance off. So make sure you're cleaning your stuff. Increase your water intake. Okay, that can absolutely help with dry mouth. If the body doesn't have enough liquid, it has to piece and parcel out the amount of hydration in the body, and sometimes the teeth in the mouth can be last. So make sure you have enough water in your body to meet your needs. Avoid extreme temperature changes. Okay, so we have to be careful with hot coffees and cold lemonades and things like that. Those are going to exacerbate your symptoms if you are currently suffering from any of these issues. Visit a dentist regularly. Okay, most people have some type of dental insurance, but not most people use that dental insurance. So use your insurance if you have it. If you do not have insurance, there are usually dental colleges and institutions near you that can do those services at a discounted price. So even if you don't have it, you still have the means and the access to get the care that you need. So make sure that you are reaching out. And at the end of the day, this is happening because you are having a decrease in your hormones. So consider hormone therapy to introduce synthetic hormones back into the body. Now, there are going to be side effects to that, so please talk to your doctor about hormone therapy if it is right for you or not. It's not right for everybody, but that is an individual decision. That is not a decision that I nor anyone else should be making for you. Okay? So those are some of the things you can do. Although hormone therapy, replacement therapy is effective, it does not necessarily help or prevent with oral symptoms. So that might not, that necessarily, it could help, it could work, but it doesn't work for everyone. So, and depending on how far along it is too, like that could be an issue as well. So just talk to your doctor if you are worried about the amount of hormones in your body and how the body's using them and stuff like that. Okay. And for the the people in the back, your sexual health is super important. Okay, and a part of that is how you see yourself, how you view your body, how you view your sexual energy, how you view your presence in the world. And so if you feel like that is going to become an issue for you, then you have every right to bring that to your doctor. Hey, somebody said my teeth can fall out from menopause. Like, what does that look like? What do I need to be preparing for? Like, what are we talking about? Like, what's the data on that? And don't feel weird about bringing that up, bringing up dry mouth, bringing up a dry vagina. Whatever kind of symptoms that you are having that could be a side effect of your menopausal symptoms are your doctor's business. Okay. Even if they're not bringing it up, you have every right to sit in there and be like, hey, my coochie is dry, my mouth is dry, my skin is flaking. What does all of that mean? Okay. So don't cheat yourself, advocate for yourself, and do not give up. Okay. Come on, where are you? There you are. Okay. Dang, I couldn't even find it. So yes, menopause can have an effect on the mouth. I know that's not what we were expecting, but your teeth can absolutely fall out from the side effects of menopause. Okay. And so I know that sounds super scary, but there are things that you can do to lessen your chances of that being your life. And you just have to do it. But you can't do it if you don't know that this is something that's going to happen, right? I wasn't aware that, menopause can make your teeth fall out. I actually wasn't aware until they Healthline asked me to write this story. So I was like, my mouth? Wait a minute. So Ooh, I think somebody's here. Are they here? If they here, I gotta go. Hold on. I thought I heard some doors closing. I think I do. Okay, well, mm, we'll see. Let me see if my brother said we outside. Yeah. So that's them. Okay. I gotta go. The kids is here. I gotta go. I'm sorry. My hands are tied. Okay. All right.